Hello and good morning or afternoon, wherever you may be. My name is Matthew De Geeter, the Senior Vice President of Strategic Enterprises at the American Society of Interior Designers. It's my pleasure to welcome you to today's webinar, our ASID Member Benefits Spotlight Health Insurance Program. Thank you for joining us today as we kick off a new webinar series. So this webinar series highlights ASID member benefits, tailored for current individual members, organizational partners, and potential new members considering joining. So in the next 20 minutes, pretty quick, we'll be covering the following. We're going to explore a member benefit, hear from a member herself, learn how to sign up, and get your questions answered. So as attendees, your audio is muted and the attendee chat is disabled. So instead, please use the Q&A button on your toolbar to submit your questions at any time throughout this webinar. We will respond to your questions during the Q&A portion at the end of the presentation. So I will be your moderator for today, and I am joined by Peter Rowe, who is the President and CEO at Arcwood Benefits Consulting. Arcwood is our program partner for the ASID Member Health Insurance Program, and Mary Marsh, Principal Interior Designer at Lillian James Design Group. Mary is an ASID member and utilizes this member benefit. Hello, Mary. Hello, Pete.
Hello, Matt.
Hi, how are you?
Very good. Delighted to have both of you with us.
Likewise, thank you.
Glad to be here.
So, Pete, first I'm going to hand it over to you to give us an overview of the member health insurance program.
Sure. Thanks, Matt. And welcome to our program. I want to first start off with a little bit of background about kind of the whys. So through some studies, we understand that about less than half of ASID employers with less than 50 employees are actually currently offering health insurance. If you dig into those studies further, we also understand that even less than 60% of the ASID employers that have greater than 50 employees are offering health insurance. And so when you kind of look at these numbers, everybody understands that one of the number one important benefits that everybody's looking for in recruiting today is health insurance. It's also, from an employer's perspective, probably one of the top 3 or top 4 expense items on your budget. And so having the opportunity to create a program that's being sponsored through ASID, which we can help improve benefits, reduce expenses, and give everyone the opportunity to level the playing field is a really exciting conversation that we're going to have today. So if you want to go on the next slide, Matt. Some of the solutions that we're providing, that we're looking at providing to everybody is really focusing on the day-to-day operations of delivering healthcare. We are not asking individuals to change who they see. We're not asking individuals to travel. We are essentially looking at ways that we can design health insurance programs that take the inefficiencies out of the industry. So first, a base understanding of kind of how health insurance works. We have a premium dollar that we pay every single month. That premium dollar is going to be about 20% of the cost, or 20% of the cost of that dollar is what it costs to actually operate the plans. The remaining 80 cents of that premium dollar is going to be factored on the cost of the claims that we're utilizing. So what we've learned throughout this industry and throughout our practice is that there is no correlation between cost and quality based upon the individual providers that we're seeing. We did a quick study, actually it wasn't a quick study, but we did a study just for colonoscopy. It's a routine thing that everybody needs to go through once you reach a certain lucky age. However, we looked at 19 different PPO networks, and this is reinforced by a study that came through through New York Times. They published this in August of 2021. But we looked at 19 different provider networks for the cost of the colonoscopy. The most expensive one was 1,200% more than what Medicare pays for that same colonoscopy. So Medicare is the largest deliverer of health insurance in the United States. So they're kind of our benchmark of what things should cost. The least expensive was 118%. When the New York Times did this study, they recognized that they had an insurance company that was charging $2,400 for a colonoscopy that had a second insurance company that was charging $1,100 for a colonoscopy. However, you could walk in the door and pay cash, $700. So there's a lot of questions that are going to be unanswered right there. But the first question we get is, who's the insurance company? Is it a household name? It's not going to be a household name for these reasons. The household names, the insurance companies that we know that advertise on TV, they are for-profit entities. What we call premium, they call revenue. So we have designed this purposefully to make sure that we can institute something called a member advocate into this process, so that when you're going through some type of a treatment program, if you're looking for a specialist, if you're looking for a specialty medication, we can get you in front of a member advocate, which can then help make sure you get in front of the providers that are high quality, but also cost effective. A good example I have for myself is I tore up my shoulder back in January. I tore off 3 tendons of my shoulder. If I would have gone into the hospital system, which is the normal direction that I typically would have gone into, that surgery would have cost about $50,000. But because I went through a member advocate and I asked the questions about quality and cost, they redirected me to an independent facility. I had not heard of that facility before, but it's an independent facility down here in Scottsdale, $16,500. It's a third of the cost. Reflecting back to my first conversation, is that the premiums that we're paying, 80% of the premium is calculated on the cost of the care that we're receiving. So if we can make the plans easy to operate and institute a member advocate inside the process to help get us into the appropriate site of care, we can reduce that expense. If we can reduce that expense, and we can reduce the premiums. But one of the most important things in this conversation is that by utilizing a member advocate, your out-of-pocket expenses will be waived. So one of the biggest stress points in our society right now is the cost of healthcare and what we pay out of pocket. We have premiums that are $25,000, $30,000 a year for a family, and we're asking individuals that have an average income of about $70,000 to spend $8,000, $9,000 per person in their family out of pocket. Nobody can afford this. So these programs increase financial wellness by giving us the opportunity that we can get us into the appropriate site of care, which means that your out-of-pocket expense could be zero for outpatient surgeries, inpatient surgeries, some specialty medications. So these plans are very purposefully defined and designed with that mission in mind. Matt, you can go on to next slide. So what to expect? We have thought that this through purposefully, that we know we have independent contractors, sole proprietors. We have a program that'll fit these design mechanisms specifically for you. We have 5 programs to choose from. Their premiums are what we call as age rated. So based upon how old you are is going to be based upon what the premiums are going to be. But we'll definitely talk you through. Your most important action item in today is just schedule a call. Get in front of one of us at Arcwood, and we can walk you through all your different options. We have year-round program and eligibility for the individuals. So typically on healthcare.gov, open enrollment is going to be only in the 4th quarter of the year with an effective date of January 1st, unless you actually have a qualifying event. These programs under ASID, you can effectively enroll in during the year. You're not limited to just open enrollment. We also have added the ancillary lines of coverage from the dentals, the visions, the life, and the disability and supplemental insurance, also from individual sole proprietors all the way through large corporations as well. So that can also now be a part of your conversation. Next slide, Matt. And then for our groups that have 10 or more insured, we can put together a little bit more of a customized program for you. So you have a little bit more flexibility in understanding or designing which plan options to offer. The rates are going to be the same for all employees, regardless of age, all employee spouse, all employee children, or all families. So they're called composite rates. So it's a little bit easier in creating your pro forma and your budgeting. You get to decide when you want to join this program, so you can have an effective date any month of the year. Also, as well, you have the dentals, the life, disabilities options that we have also put together specifically for the members of ASID. But it doesn't make a difference who we are in the spectrum of a sole proprietor all the way through large corporations. These programs are designed to improve the financial wellness of the employer because we know we're saving premium costs anywhere between 15 and 20%, depending upon the structure that you choose. But then also we have the opportunities to increase the financial wellness of our members, because we now have the opportunity to waive the out-of-pocket expense for someone who's actually using the insurance, which again then increases their financial wellness during a very stressful emotional time. You can go on to the next slide, Matt. Or
Thanks, Peter. So a lot of information there in order to really navigate through. So obviously, healthcare and health insurance is complicated. Figuring out what you need, complicated. Navigating the system, very complicated. And so that's why we have Mary here, who's gone through this process and actually worked with Peter and the team at Arcwood to actually sign up for herself in the firm. And so Mary, wanted to get your insight and your experiences in this process.
Yeah, well, thank you so much for having me here today. I'm super passionate about this whole experience because as a business owner, it's incredibly overwhelming to navigate this whole health insurance and different benefits for employees. And I've been a member of ASID for a very long time, and I've been a business owner for 10 years. And one of the things that was always daunting to me was, how in the world do I go about getting this benefit for my employees? And how do I become competitive in the marketplace? So when I'm out there looking for new talent, I'm up against other design firms who may be able to offer, some of these benefits that, quite honestly, I just don't know how to get a hold of and figure out how to navigate. So when Pete came to Scottsdale during one of our chapter meetings and I attended, I was super excited to hear that he has a team. And, they're willing to navigate it for us. I set up a meeting with him, and it was actually a lot easier than I thought. I mean, there's a lot of parts and pieces that, go into it. And there's a lot of, deciding, can I afford this? What are the numbers? What are my different options for my team? And as we went through it, I realized actually this isn't all that, of a difficult thing for me to be able to provide and access. So, I also feel like this is something that, bringing in young employees, which, there's a lot of young people out there who do not have health insurance. And so, again, being able to provide this for the employees, I was super thrilled about. So it was an easy process. There's paperwork involved. There's a lot of things that, there are questions, but I was all answered super easily. We were actually very fortunate that Arcwood actually kind of took the next step for us and found a plan that was available through the state of Arizona and got us actually an even better opportunity, which really lowered our premiums, which actually made it so that I could provide a little bit more for my employees, and their costs were even less for the next couple of years. So we opted into dental, vision, and health insurance. We've been with them for a year now. We just went through the renewal process, signing a few documents, answering a few questions, and my employees are thrilled with it. And I truly do believe that this is something that has made me a much more attractive employer to potential young, new employees who are coming in. So really have enjoyed the process, and don't be scared, give them a call. I can't encourage it more.
Thank you for that, Mary, in particular. So I know, Peter, Mary, you've worked together in this process, and I'm curious if you can share about how that worked. And so Mary, in particular, you mentioned the incentive for the state of Arizona that, Peter, you were able to find out. So it's a very personalized experience. It's not just, here's the plan, sign up, ask no questions. It is really digging in a little bit further. So Peter, could you tell us more about how that works?
Sure, I'd love to. When you think about providing health insurance to our employees, it is an emotional process. Health insurance touches every single one of us in one way or another, because we all have some type of medical care that we're typically going through at any given time of the year. And knowing that, understanding that, we really just start off by having a conversation. Let's have a conversation with the business owners. What are they trying to achieve? What's the mission? We're finding that, offering health insurance as a first time, if you're an organization that just doesn't currently have it right now. We kind of walk through the pros and the cons of it, because the plan designs that we're able to offer are not like plan designs that we're seeing in the marketplace right now. And again, I'm going to repeat myself, but that's purposeful. And so we're going through the process of how powerful is that when you're recruiting to fill spots in your organization, that you can tell somebody is, hey, we have an insurance program that's going to help waive the cost of insurance, or waive the cost of the claim, by calling a member advocate in advance. And they typically come around and say that's super insightful. That's very, very helpful. But conversely, for the organizations that we're working with now that are now instituting something like this, the feedback that we're getting is that the employees that they have are anchoring into the firm, because now we're increasing the value effectively of their compensation package by, again, increasing financial wellness by reducing the stress of paying for services when we seek them. So it's really a one-on-one conversation. I mean, we have specific plan designs that we've created, and we have kind of a baseline. But when we go through the conversation with them, it's really the most value that the employer is looking for. And then we try to put together that program specific to them so that the deliverable has the value that they're looking for.
Mm-hmm. And that's very much what happened in our case. When we were talking with Arcwood and with Pete, it was, okay, what are the demographics of the employees who are seeking out this health insurance? And so, we looked at all the things that were, because it's so individualized, and, everyone has a different reason or a different, costs they can afford, or different level of care that they're looking for. And so we were able to look at that. And Pete showed us, here are some options that we could do. And then there was this third option, on the table for us, which was, just another exciting option, which was, again, very affordable. And it gave us, the opportunity to take it to the table, to the team, and say, hey, okay, here are our options. What's more important to all of you? And, from there, we were able to, collectively decide and move forward.
And kind of looking at Mary's situation specifically is that, and that's representative here just in the state of Arizona, is that the state of Arizona also understands the importance of providing insurance to our employees and our and the members, spouses, dependents, et cetera. And so the program that she was eligible for was a tax credit that was to help ease the cost of going into the program. But in Arizona, it's a limited program. It's a limited amount of years. Not all states do have this program, but we are looking at different opportunities to make sure that we can put together a program that is right for you as the employer of the group.
Mary, I think that's so interesting, because you got your options, you compared your costs. I mean, because you realized it was an investment no matter what, but also realized this was an investment in your employees, but also your firm, and how to position and compete, and how you brought that to the table to make, because then it's a shared decision in that process too. And then that investment for everybody to say, you're taking care of me as an employer, and so let's take care of each other in this process at the end of the day.
Right.
Yeah, it was, and I truly do feel like this is one of those things where, like in life, where I'll have to budget different things. But once you finally actually take a look at it, look at what your expenses are, and what you can bring to the table. Honestly, like, I haven't really noticed a huge financial, huge effect. I thought, oh gosh, this is going to be a huge thing that I'm going to tackle. But in the end, it's kind of been like, actually, it's not as bad as I thought it was going to be. So, and I would not, honestly, I don't know how I would have ever even attempted to even start the process without having ASI to bring this to the table, and, having Arcwood involved.
Well, thank you for that. So I'm going to move us along real quick, because lots of questions actually coming in Q&A. We're going to get to those in just a minute. So thank you for that reminder. Use that Q&A function. We really want to hear from you, and we're going to answer all of those questions, or as many as we can get to in our time. But probably the next step is like, so how do you sign up? So I'm going to share my screen again, because this is really what we're trying to do, is make this as easy as possible. So step one, go to asid.org. Step two, make sure you log in, because this is a member benefit. And so you only have access to this and can see this page if you've logged into your profile. So you can go through two paths. either go down under resources, you'll see from ASID Advantage, the ASID member health insurance program in the top menu, or you can go to our Design Business by ASID page, which is under career, and it'll help you navigate over there too. Once you see that, you'll get that information, and the main prompt there, schedule a call, schedule a meeting with the Arcwood team. They will walk you through everything. They actually also have a couple of other programs with ASID, so that depending on what your firm is looking to do or your company is looking to do, and this is from you being an individual to having a large organization, multiple thousands of people, we're here for you. The great thing here is this can scale with you and scale with you in your business. And that's exactly what we've intended this to do, so that it's not just something for one phase of your business, but able to move with you as well. So that's the key piece here. Go to asid.org, schedule a meeting, go on from there. But now I think what we're going to do is jump into this audience Q&A. And Peter, this might be fairly heavy for you. We're getting a little technical. Looks like. But that's good. We're moving to action, which is
good. I will do my
He
best
can handle it.
run down rabbit holes.
We'll help as much as we can. So I'm going to stop the share again real quick. First question from Rachel. Do you have a program for very small firms? I think it says 203, but I'm wondering if that means 2 to 3 employees total.
We do. We have programs specifically available to the sole proprietors, small business owners, mid-sized business owners, all the way to large corporations. So we can handle multitudes of designs.
And just so you know, when I started with Pete, there were 5 of us and there are 7 now. So we're not a huge, we are definitely a smaller business.
Perfect. Easy one there. Then what we've got from Joseph, 2-part question. So he works for a company that pays his ASID membership, but they do not offer health benefits. He currently pays his own private health insurance. So is he eligible? Could he sign up on his own?
Is that a question to you, Matt, for
I think a question
eligibility on membership?
It's not a membership question. It's like, can he go outside of his company and pursue something independently if his organization is not offering health insurance options?
Well, I guess the technical answer is yes, because we have the marketplace option that's available to us. But the programs that we're specifically talking about today are for members of ASID. And so I just didn't know if the question meant is if the firm is the member, is he also a member of ASID for eligible?
So if your firm is a member or your company is a member, so like industry partner, firm partner, higher ed partner, affiliate partner, you could have the firm sign up. And actually, Joseph, you may want to refer your decision makers to this program, because this might be something that they want to implement like Mary did with her firm as well.
Right.
Perfect.
Thank you for helping me clarify that.
Let me get through a couple of clicks here. So Deborah, is the plan for individual practitioners available in every state in the country? So do we have options across all 50 states?
We do. We do have options in all the states. We are using a national network. The network is called PHCS, Private Healthcare Systems. They have over 1 million providers. However, we also understand that, even though we have 1 million providers, we don't have all the providers. But kind of going back into my earlier comments is that we structure these programs so that even if your provider is not in the network, we call them up and we contract them for you to become in network. And we're doing that because, frankly, everybody accepts cash. And so if we call up your provider, if they happen to not be in the network and, give them a fair reimbursement, we've really never had anybody turn us down. So the network expands based upon the needs of the members that are enrolling. But yes, it's in every single state. Well, actually, I'm sorry, except Hawaii, because I think Hawaii has their own specific state program that folks are enrolled into.
Good thing to clarify. And I think a good lesson there. Cash is king.
Cash. It's crazy. It's. I will reserve comments for later times, but yes, the PPO contracts seem to be paying more than is reasonable. I'll leave it at that.
Got it. All right, then let's see. Question about age rated. So you mentioned, Pete, that the program is age rated. Is there also then a health questionnaire or a physical required?
There are not. So these are ACA qualified plans. which means is that when you join them, we are asking health questions when you join, but we specifically do that for continuity of care. Because we want to make sure that providers are contracted, that they're in network, so that there's no gaps in anything. So that is why we are asking questions. But it's ACA qualified plans, so it's guaranteed issue. Everybody gets to join in.
Nice, thank you. So, all right. Ooh, we've got more questions coming in. Keep them coming, friends. Really appreciate this. So next question from Anonymous. So sorry if I can't call your name out right now. Due to the cost of having employees, this person has gone to a virtual team. And so interested in how affordable a plan could be for a sole proprietor, because currently in a self-pay situation.
So when we look at for sole proprietors, we have 5 different options, and they range from basically just a basic plan to have something, higher deductibles. Those rates start, mid 300s for the younger folks, and then they increase up usually in about 5-year increments, and they can, maybe cap out in $500-600 range. But then our richest plans that have much lower deductibles, you can waive out of pockets by talking to the member advocate. We can waive prescription expenses. Our youngest ages, we're seeing premiums in the low 400s, maybe high 300s, and then maybe capping off at the older ages. It could be in the mid 6s. So it does range on a 5-year increment. Yeah.
Got it. Thank you for that. So network question, is United Healthcare available in this program?
So we are not using United Healthcare's network. We are using PHCS's network, which is Private Healthcare Systems. We do have a link that's on the benefits page that Matt was alluding to, how you navigate to that through the ASID.org membership site. But we are not. There's reasons where we're not, but we are using Private Healthcare Systems because of efficiency and pricing and affordability.
Got it. And so if there's questions about what network you are currently on and which providers you have, that's where I'd say schedule a call with Arcwood, walk through your options, see what you can do.
It really does. Yeah. I mean, I don't want to be crass about any of these questions. These are really, really good questions, and they're very, very important. But I do think it's important to understand that we are not using these household names for very specific reasons. And if you want to dig into the details, I would invite you to look at United Healthcare as an example, only because they came up in a question. But if you look at the stock price of United Healthcare and healthcare reform was passed to the new high it just passed throughout this week, it's up about 3.5 times more than the Dow and the S&P 500. And it's just, there's inefficiencies and misaligned interests that are inside those types of organizations, which is why we are using entities that are not household names, because we're able to lower the cost of the expensive care, and that provides you as a member opportunities to have 0 out of pocket when you're going through treatment.
Perfect. So I'm going to take one of the there's a few questions based on eligibility from like the membership side. So for everyone to know here, this program is available to all of our practitioners, educators, students, and affiliate individual members, and then also our firm partner, industry partner, higher education partner, and affiliate partner. So if you're an ASID member, you have an opportunity to sign up for this. If you're looking for you as an individual or a small group, from that 1 to 9 range, or 10 plus. So that's considered our larger group right now. So all of you are eligible. Take advantage of it. Please do. It actually is, the more people involved, the bigger benefit it is actually to you as members too, because we're able to negotiate better pricing on your behalf as well. So there is an interesting question about advocate, and I know we're coming up on time, everyone. What we didn't get to, we're going to make sure we can follow up with you. It sounds like we're going to have a few FAQs to add to the website so that we can actually get more of this information there. And if we haven't been able to answer your question directly, please know that the next step is to call the Arcwood team, set up that meeting, and walk through those nuances and those specific questions so that we can help guide you to the best solution for you or your organization. But I wanted to pull out this member advocate question because Jill has asked that it sounds nice and it sounds like a great thing, but also how does it work? Is it cumbersome? How easy is it to contact them? Because you're in that moment and needing care, is it easy to get a hold of them? Or are you dealing with long wait times, needing to schedule that in advance? How does that work for us, Peter?
That's a fantastic question. So I'm really glad you brought that up. First and foremost, if it is an immediate situation, seek care. Emergency rooms, urgent cares, life-threatening situations, always seek care first. Then contact the member advocacy team and then fill them in on everything that's happened. When you're looking for non-emergent situations, as an example, if you're scheduled for an MRI, contact the care advocacy team in advance, because what they're going to do is they're going to help make sure that you're going to a freestanding facility versus something that might be owned by a hospital system. Just because we've learned through experience is that there's been a lot of mergers and acquisitions in the facility side of things. And so the hospital systems now, they own family practice, they own specialties, they own radiology, they own labs, and they're more expensive. And so the purpose of having this member advocate is to make sure that we can get you directed to somebody that is freestanding. And incidentally, and this actually is not incidentally, those freestanding facilities that are specialists in a certain thing are better quality. They do more of them on a day-to-day basis, and so they have a higher quality. So that makes it less expensive and a better quality. Now, couple different options is you can just we have a toll-free number. So on the back of a card, you're going to have a toll-free number. Call them up, and there's going to be a call center that's going to answer the phone, and they'll start working with you immediately. Can there be delays? Absolutely. Because if there's a provider that is not currently contracted in the network, or we're pre-authorizing a surgery, or there's something that we know is happening in advance, that can take a little bit of time based upon the response time of the provider that we're seeking coverage with. So getting in front of the advocate is not hard, and it's efficient and it's easy. However, definitive answers might come 48, 72 hours later, depending upon what the reaction time is of the providers that we're reaching out to.
Thank you for that, Peter. And thank you for those questions. So we do have a lot more questions, but we are out of time. So I'm going to wrap this webinar up for us, but we will follow up with your questions as well and make sure we make those accessible to you after this webinar. Thank you for your active engagement. Really appreciate that, but we also want to be very conscious of everyone's time. So I am going to share this screen one last time, but as I do that, I'm going to say, whoops, I have to actually hit share to share. There we go. All right. And with that, what I want to say is thank you so much. That includes our first Member Benefit Spotlight webinar. So first, huge thank you to you, Peter and Mary, for being here, providing your experience, your insight, and really helping to connect this benefit to the ASID community. I'll let you sign off as I switch over and wrap things up for us today. And then I also want to say thank you so much to you, our audience. Your engagement and your questions, please keep them coming. We're here. We built this program for you, our members, and a reminder of all members. So if you're an individual from the practitioner, educator, student, or affiliate member, as well as our partners, so industry, firm, higher education, and affiliate partners, you can take advantage of this program. So a recording from today's webinar will be available on the ASID YouTube channel, linked on the ASID website, and we'll also share this in Design Connection by ASID. Please be sure to fill out the survey at the conclusion of this webinar. Your feedback will help us improve the program, and it'll also help us make sure to know how to follow up for you if you're looking for an individual, small group, large group plan, and so we can get you connected to the team over at Arcwood as well. We're going to be continuing this series in October, as we will share more information about ASID member benefits, so be on the lookout for those upcoming webinars. We'll keep them short, just like this, 30 minutes, and go from there. And then be sure to check out all the programs available through the Design Business by ASID to help you start, build, and sustain a healthy practice. And with that, I want to say thank you and have a good day.